Okay, I want everyone to think of 6 women in your life that you currently have. A woman that you love, care for, and found profound value in. Statistically, one of these 6 women will be diagnosed with infertility. Now, maybe this statistic doesn't mean anything to you, and for a while, this was just another number. It didn't hold much value to me until I saw the hidden struggles that infertility held. And unfortunately, infertility is a condition that is affecting both female and male. But today I want to focus and draw our attention to how infertility is affecting women. Infertility will affect us all, either directly or indirectly, whether we realize it or not, which is why we need to care about this. Because infertility, unfortunately for women, is affecting them mentally, physically, and emotionally. So I want to overall this whole presentation, I want to dive in a little deeper of what the concept of infertility is and the hidden struggles that are found, because this is more than just a condition for a female. This is something that will forever impact their life and their family. So, infertility is a condition found in the reproductive system that is preventing approximately 48 million males and females all over the world. And specifically for women, there are 3 different types of infertility. There's primary infertility, secondary infertility, and unexplained infertility. Primary infertility, approximately 1 in 5 women will be diagnosed with this. What this is when a female has been trying to conceive for over a year and has not been successful in doing so. Secondary infertility, approximately 1 in 20 women struggle with this. This is when the female has had a successful pregnancy, however, is when trying to conceive again has not been successful. And then unexplained infertility, approximately 1 in 5 couples struggle with this. And what this means is that there is no probable cause, there is no real pointer as to why this female is unable to conceive. So there are different causes of infertility. And infertility, the causes are found in the reproductive system of a female specifically. This is half of the uterus. And so over here, the most common disorder that prevents from females from conceiving are ovulation disorders. So some of these ovulation disorders consist of endometriosis, kidney disease, cystic fibrosis, polycystic ovary syndrome, primary ovarian insufficiency, and a couple more. However, these are the primary ones. So these ovulation disorders would be found, these are your ovaries, so these are your fallopian tubes, and this is half of your uterus. So ovulation disorders would be the process of right here where the ovaries, the eggs are produced and come through the fallopian tube into the uterus. So any type of failure here would be a type of ovulation disorders. And of course, there are some preventions for a female to decrease the chances of becoming infertile. However, this does not eliminate 100% the possibility of developing infertility down the road. So some of these are maintaining a healthy lifestyle, moderately exercising, stay away from toxins like lead, cadmium, and mercury, and eliminating or limiting the consumption of drugs, smoking, or alcohol. As doing all of this will help to the ovulation cycle for a female to be more consistent, healthy, and moderate. So there are different treatments for these patients. The regular treatments and extreme treatments. So the regular treatments, gaining and losing weight, no drugs, no alcohol, no smoking. And there are medications, there are pill medications. However, the most common form of medications for these patients are through injections in the abdominal area. And there are also surgeries to perform to open any blockage found in the fallopian tube or to remove any polyps found on in the uterus, ovaries, or in the fallopian tube areas. So unfortunately for some patients and for a lot of patients, these regular treatments are not enough. So they have to go and proceed and do extreme treatments. So these extreme treatments, the most commonly known treatment is in vitro fertilization, which basically what this consists of is specialists go in and take out a couple of eggs from the female, and then they place them in a lab dish. Then they grab the male's sperm, and then they place them in the same lab dish and let them fuse together. Once they're fused together, the specialists take up to 3 eggs and place them back into the female's uterus. And then there's intracytoplasmic sperm injection, known as ICSI. This is most commonly seen when the male is infertile. However, it's still very common for females if that is the problem with the infertility, if it's her problem. And this is a type of in vitro fertilization. So what this is, kind of the same process. They take out eggs from the female and then place them into the lab dish, like we see in this picture. And instead of placing the sperm into the same lab dish, they directly inject the egg with the male's sperm. And then they place up to 3 eggs back into the female's uterus, fertilized eggs back into the female's uterus. Then there's intrauterine insemination. So this is where specialists directly go and place the male sperm into the female's uterus. Then there's assisted hatching, is where they go in and they open the outer lining of the embryo so that it can easily attach to the lining of the uterus. And then there's third-party ART, which is where there is usage of a donor egg, donor embryo, or donor sperm. And with these treatments, there comes complications. So whenever there is more than one embryo transfer, like we see in an IVF, ICSI specifically, there is a very high chance for the female to have twins, triplets, quadruplets, or even more. So whenever that is the case, this puts the mother's life at risk. And not only that, but this also increases the chances for miscarriage, premature birth, neonatal death, and like I said, puts the mother at risk and is very, very excruciatingly painful for the mother. And then there's ovarian hyperstimulation syndrome. So basically, what this means is because of all the medications that you're taking, because of all the injections, all the different processes that the treatments contain, this begins to send too many signals to the ovary to function. So they overfunction and they begin to expand. And this is super, super, super painful for the female to experience. Because just look, this is where your ovaries are at, as we see. And so this condition, the syndrome, your ovaries begin to expand. So when they expand, this is connected to the fallopian tube. So when they're connected and expand, the fallopian tube also begins to expand with it. And so all of this is connected. So any little thing with the ovary expanding, everything expanding, will cause for the whole reproductive system to fail, and like I said, very, very painful. Then there's ectopic pregnancies. This is most commonly seen for patients who go under IVF. So the embryo is supposed to develop in the uterus in this area. However, for ectopic pregnancies, this means that the embryo is developing outside the uterus, so anywhere on the fallopian tube on the outskirts, for example, right here. And unfortunately, this will lead to a miscarriage because embryos cannot develop in this area. So, infertility is not only complex, and as we saw, different treatments, and there's different complications from these treatments that cause physical pain for the female. There's also infertility causes a lot of emotional pain for them as well, mentally and emotionally. So for instance, miscarriages are a very, very common thing for infertile patients. Now, to clear up a misconception, just because a female has a miscarriage does not mean they are infertile, because fertile females have also experienced a miscarriage, but like I said, this is a completely different concept of infertile. We're talking about infertile females who experience a miscarriage. So this is seen and felt as a literal death of a child when a female experiences a miscarriage. Therefore, this triggers as a traumatic stressor for them, and they develop grief and loss. And the most common side effect 1 month post miscarriage that is seen for females is PTSD. And a study was done that they compared fertile patients with infertile who had a miscarriage, and they saw that females who were infertile and had a miscarriage had higher levels of distress than females who had a miscarriage and were fertile. And then we move on to the medications. These are the most common medications used. Like I said, through injections in the abdominal area is the most common one, like those. These medications are taken obviously to activate the ovulation cycle, keep it active and moving and so forth. But these medications are also seen to increase depression and anxiety levels for these patients 25 to 60% higher than the regular population. And then there's treatments like we went through IVF, ICSI, assisted hatching, all of that. So all of those treatments, any female who undergoes those treatments are known to experience 15 to 54% experience that go under these infertility treatments experience depression. And then um, these patients who go through these treatments, their levels of anxiety are seen 8% to 28% higher than the regular population. And then specifically for IVF, these patients are seen to have a lower self-esteem and higher levels of depression compared to all the other treatments that they go under. So it is very important, obviously, for females to undergo treatments as the hopes of becoming mothers one day. However, it is also very important to take care of themselves mentally and emotionally, as this is also affects them in that aspect as well. And so, clinically, the very most common techniques that are used to help lower levels of depression, anxiety, and stress levels seen in women are cognitive behavior therapy, relaxation techniques, and expressive writing. Cognitive behavior therapy changes unhealthy thinking, feeling, and behavior to a more positive thinking and seeing of the aspect of what you're going through. So this is highly, highly recommended for specialists, from specialists for infertile females to consider. And then there are relaxation techniques which are known to use to help diminish levels of anxiety seen, like meditation, listening to music, going out for a walk. So these are kind of like day-to-day things that females can practice, daily, that will help lower and decrease the stress of what infertility has been causing them. And then expressive writing has been known to help lower stress levels. And like I said, there are other techniques. However, these are the most common and that have been proven to actually have a positive effect for infertile females. Why I care. So, at the beginning, I asked you guys to think of 6 women who you love, care for, and value significantly. Up here is a woman that I love, value, and care for significantly ever since I was a little girl. This is my mom. My mom was diagnosed with endometriosis at a very young age, and she had her left ovary taken out at the age of 17, and they told her that she couldn't have kids. And God sent her me. And I always grew up wanting to be a big sister. My parents wanted another child, but there was this dilemma of infertility. So I went through the entire process with my family, my mom specifically, of going under treatments, regular treatments such as IVF. Specifically, my mom underwent a total of 7 surgeries, and for none of them to truly work. And we went through medications and all the process, all the lows and highs of infertility. And none of them worked. In fact, my mom experienced a miscarriage before me, and then at the age of 8, I experienced her having another miscarriage. And the hardest part of the journey of infertility for me is the miscarriage part. As I felt when my mom told us that she's pregnant, I got so excited. I was very happy, and I just felt like my dream was finally coming true, that I was going to be a big sister. However, I felt like that was robbed away once I went to the doctor with her and they told us there was no heartbeat. That will forever change my life and how I view infertility. For the longest time, I was mad at God because I didn't understand why he was letting my mom, someone who I loved, care for, and someone who she loved God, why was she going through something so painful? Why was she, because this is a painful process. Not only does it hurt emotionally for her family, but the pain that she experienced that I saw, and I wasn't even physically feeling it, was something so unreal. The pain from waking up from surgeries just for them to tell us we have to do it again, putting her life at risk just so my dream can be fulfilled and our family's dream of having another child, just for all that to be robbed away. So I was so mad at God because I didn't understand why, and I wanted to know why we were going through this. I wanted to know why my mom, why my family. And for the longest time, that was my question. But then I ran into this verse that says, Jeremiah 29:11, "For I know the plans I have for you, declares the Lord, plans to prosper you and not to harm you, plans to give you hope and a future." I felt like when I was reading this verse during that time that it was just God breathing a little bit of hope in me. Because God, who is so loving and graceful, despite my attitude towards towards Him, despite how I was feeling because of everything, He loved me so much that I felt like through this verse, He talked to me directly and let me know that maybe the plans, maybe the dreams that I had of becoming a big sister, or the dreams that we had as a family, were not His plans. I can't tell you why, but I can tell you that His plans are better than mine, and they're plans to prosper me, and they're not to harm me, and they're plans for hope and a future. So, despite the outcome of infertility for my family, I know that we still have a hope and a future in Him and in His plans. And for any family, for any person experimenting infertility, I would take them to this passage because it is just a breath of life. That despite, like I said, the outcome of your infertility journey or of whoever's infertility journey, because every journey is different, God's plan and timing is better and is perfect, and it's not to harm us, and it's to fulfill us, and it gives us hope in the future in Him, regardless of everything. So today, I want to encourage every single one of us, female and male, to care, because this is something that is affecting millions of males and females, not just females. I know I specifically focused on females, but it is something that will directly or indirectly affect us, which is why you need to care and you need to be aware of the complexities and hidden struggles of infertility. Thank you.
I want to open it up to, I guess we got a few minutes, but if you got any feedback or questions for Mariana?
In your family and your family's story of going through this journey, how did it? I know you focused a lot on your side of it and your perspective, as well as watching your mom go through this. For your dad, was there any other byproduct or something?
So, as for my dad's part, just kind of looking back at it now, my dad, for a while, or my dad has always acted as the strong person in the household, quote unquote. So, the side of emotion, it was hard for him to show, seeing how broken me and my mom felt. So, yes, I saw him cry, which hurt me even more because for my dad, for example, it's not normal for me to see him cry. Specifically for my dad, I'm talking about. So I saw how this journey of infertility definitely impacted him because I saw how vulnerable he was, despite how strong he tried to put on an act and be the pillar for our family during that time. But I think that regardless of what role you play in a family, this is something that will impact you whether you realize it or not. And it's not something you can hide, because if this is something you care about, which for instance for him it was and it is, it's something that is going to change you.
Thank you for that, by the way. Like it's always, a lot of students that will ask to do a presentation on something that not necessarily they're like trying to get a job in this field or anything like that, but like just something that's really personal. And I call them awareness projects. Like you're just trying to make people aware of it. And it's always, it's like, can I share my personal story? And it's like, sure, go for it. It's always harder to share a personal story in public than it is to write it in a paper. Anybody can write it in a paper. So like, thank you for that. That takes a lot of courage. Yeah, Coach Seo asked my question sort of from a different angle. Elephant in the room is that you've got a room full of guys and then a handful of girls, right? Where we at, like one to 3 years old, 1 to 2. So I would like to speak to them. If you have anything to add, please do so, fellas. This is one of the I'm talking here in hear me as an uncle, okay? Um, this is one of those topics that if you feel like, I don't see what this has to do with me, you might be justified in thinking that way, maybe. But a mature version of yourself would understand this might not be something that you see directly impacting you, but one of the messages your classmates trying to get across is, oh, it impacts you whether you know it or not. But also, this is one of those topics that you might need to get a woman in your life that you care enough deeply enough for this kind of thing to matter. But also, all of you have at least one of those women in your life that you ought to already care enough about for this to matter. Is this making sense? Bottom line is check your heart if this doesn't seem to matter to you at all. Whenever you're given something really, really emotionally strong like this, there's a right way, there's an appropriate way to respond to it, there's an inappropriate way to respond to it, right? And I appreciate the fact that all of y'all are at least appearing to take this seriously because you're not joking around having a good time. I appreciate that. But seriously, take some time to think, how much does this matter to me? Do I care about these kind of things? Because a real man would care about like talking about her father is very meaningful that way, right? And knowing how to handle these types of things as a man is a really important thing. These ladies are hearing about a topic that impacts them in a way that will never impact us. But if we're going to be the men God calls us to be, then we're going to learn how to empathize and how to sympathize with these types of things, knowing that at some point, should God choose to bless us this way, it's going to impact us. Is that making sense here? So don't, what I'm getting at is don't walk away from this thinking, this got nothing for me. No, take a minute, really think and inspect yourself and see where your heart is on this stuff. Yeah, that's all I had. I didn't have any answer all my questions. So, and we've got 3 minutes. Anybody have anything for either Doris or Mariana?